Hey there, welcome to the Thriving in Wellness podcast with Haley and Caitlin. This podcast is for women who are tired of just surviving and ready to truly thrive. It's time to reclaim your health and build trust in your body.
Join us as we myth-bust nutrition topics, tackle your mindset, and dive into the nerdy side of women's health. Just a reminder that this is meant for educational purposes only and is not meant to be used for medical diagnosis or treatment. Now let's jump in. Hello, and welcome back to the Thriving in Wellness podcast. I am so excited today because we have Justine back with us. So she was actually in season 2 when we were talking about getting in tune with your body. And we had talked a lot about with Justine if we should be using some of these different tracking devices like the, wearable watches and things like that. So fantastic episode. We had such a good conversation. So please go back to season 2 and listen to that one. But because we had such a fun time together, we wanted to bring Justine back for season 3, but this time we're going to be digging into trauma a little bit more. So Justine, will you introduce yourself? And yeah, just tell the listeners a little bit about you.
Yeah, so I am Justine Capps. I am a registered nurse and holistic nurse. I'm also a board certified nurse coach, meaning that I use my nursing background in order to help people live a vibrant life. I primarily work with clients who are struggling with stress, and within the stress relationship comes trauma. I utilize a functional test called hair tissue mineral analysis. And within hair tissue mineral analysis, I am able to see the bidirectional relationship of a person's mental capacity and physical symptoms in their body.
Yeah, I'm really excited to dive into all this and how that shows up with the testing and everything. But before we do that, could you, define or describe what you would consider trauma or because I know there's some misconceptions, but some people would consider trauma, but you might think differently. So if you could just kind of clarify that for us.
Sure. So trauma is definitely a buzzworthy word right now. It's like no matter what's going on, it's like, oh, I have trauma. I have trauma. Trauma just means that it overpowers the body's ability to cope. So a traumatic response is when the body is trying to make sense of something and it can't make sense of it. It's beyond its capacity to cope with a situation. And so in the trauma world, there is big T and little t, basically meaning big trauma that is truly life-threatening, like car accidents, abuse, crimes, death. This is going to be categorized as the big T. And then there's little t, and little t could be breakups, feeling dismissed by parents, not feeling seen and heard, losing a job, bullying, rejection. So trauma can really be, trauma is very different, specific on each person's capacity to cope with things. And so when you have more traumatic experiences, your body becomes very depleted.
Mm-hmm.
And as it becomes depleted, you're not able to cope with normal everyday stressors, which is why they go through, the body keeps the score because the body is going to remember certain stressors. And if you're not able to release those and let those go, you don't have energy to move without your day and handle certain situations.
Yeah, it's really interesting. I think the timing of this is fun because I just talked to one of my good friends that we haven't talked in a little bit, but we had a phone call last night and she unfortunately has gone through some, I would classify as big T trauma in her life. And she's gone through like years of counseling and everything, but most recently, a couple months ago, she was just telling me about how she went through this program and it really brought in like the physical side of things versus just like the talk therapy. And she's like, it was life-changing. Like my gut health, my immune system, like all of that is so different now that I've worked through that, like on the physical side. So I just think the timing was really interesting, that we were talking to you today.
Yeah.
But yeah, I've definitely seen that with my clients and personally with friends and family too.
I've seen
Well, and
it.
that's the thing.
like with, going through, I would describe it for myself as big T trauma. And as I did like EMDR therapy,
Yeah.
improvements in my own gut health was
Mhm.
what I noticed the most. So, so fascinating.
Yes, and I see that a lot, especially a big one is with autoimmune.
Mm.
I see it a ton with autoimmune disorders. And if you think about autoimmunity, autoimmunity means your body is attacking itself, right? And so the body is designed to get rid of any type of invaders, right? Our body is so smartly designed that anything that feels foreign, the body starts attacking. And so when the body doesn't feel safe, the way it's trying to control the situation is by attacking itself. And so that is the big connection with the mind and body, because if the body's not feeling safe, now you have a confused nervous system that starts, attacking your own body in an attempt to be like, hey, we're trying to make you safe, so we're going to attack these invaders. And that's kind of how I see trauma show up a lot in the physical sense of people having these physical symptoms, whether it is gut health or autoimmunity. We know that majority of things are stem from the gut, but when we really dig deeper, it's like, wow, everything's stemming from the gut, but it also comes from the brain too. And that mind body connection of how everything is encompassing, our entire body, and how our body truly is keeping the score and causing us to feel these symptoms.
Yeah.
Yeah. Oh my goodness. I'm so excited to dive in a little bit more. So why don't you tell us how you use this HTMA test to kind of assess someone's trauma? Because I know Haley and I both use HTMA, as part of assessing their nutritional status. But the lens of, trauma is just, it's so unique.
Can I pause real quick?
Yes.
Yeah.
I know we've talked about the HTMA, but I just think, just to clarify in case you haven't heard it on a previous episode, what we're referring to is a hair tissue mineral analysis. So it's a hair test that all of us do to assess your tissue mineral status, because blood is not always the best indicator of actual mineral status. So we use this as a different strategy. So just to define what that is. So go ahead, Justine.
Yeah. So hair tissue mineral analysis for my practice, I do have some nutrition background, but I really focus on the lens of trauma and stress in the body. Because we know, that mental and physical part is so imperative in healing. I'm able to see, how somebody is absorbing these nutrients, but a lot of it has to do with patterns of the mind. So for hair tissue mineral analysis, it does give some indications of trauma response. So there'll be a category of basically how many markers you have for a trauma response out of 11. So I see that as a baseline to be able to assess someone, having more trauma than most. Anything over 5, I know that it's something that is likely needing to be addressed. Within hair tissue mineral analysis, it gives us 4 vitality minerals, and this is going to be calcium, magnesium, sodium, and potassium. With these 4 vitality minerals, the reason they're called vitality minerals is because they're giving energy and life to every part of the body. A question that people come to me once I say that I am able to see a trauma response and different trauma living inside the body is they'll start spitting out specific events, being like, oh, well, I had this happen to me 5 years ago. Is this going to show on my hair tissue mineral analysis? And the answer to that is maybe. Have you changed patterns since that event 5 years ago? What have you done to cope with this event? And a lot of times people will tell me that they have gone to talk therapy. And when I ask them their experience, they're like, I don't know, I was just kind of going through the motions, which doesn't mean that the talk therapy was not successful, but you cannot force someone to feel safe when you're talking about a traumatic event. And in order to move trauma out of the body, you have to feel safe. So within these 4 vitality minerals, calcium, magnesium, sodium, and potassium, each one gives me a better indicator of the questions to ask without rehashing the whole event. So when I see calcium and I realize that it's high, this lets me know that I need to be talking more about protection and feeling safe. The body will actually form what's called a calcium shell over the cells in attempt to protect itself if you are constantly the rock for everybody. I see this a lot in my clients who are dealing with grief, taking care of a lot of elderly parents, losing a loved one. And so what the body does is it says, we're not letting anything get into these cells because we're not safe. So instead we're blocking out all of these important vitamins and minerals you need. And so with that calcium pattern, I'm able to ask more questions like, where do you not feel safe? Where are you the rock? Where are you constantly pouring into everybody else and no one's pouring back into you? I see this a lot with my very, very strong clients and that's how they come off. Oh, I've always taken care of everything. I'm the strong one in my family. And that's another, going back to the trauma response, when we create these things, we put these labels on things and we are like, this is who I am. We're not leaving any room to go one way or another. I am the strong person, but I'm also a human and I'm entitled to human experiences. And so really reframing that with calcium is a big one. With magnesium, this is going to lead me down to more like productivity and worth. Functioning beyond capacity, where it's just like, I'm just going to keep on going. I just want to keep on going. And I notice a lot here with feelings of anger and resentment because they're pushing and pushing and pushing. And then they're saying like, I'm snapping at my children. Like, they spilled milk. This isn't the end of the world, but I just can't. It's too much. It's beyond. And that feels like a traumatic response because it's pushing them too far, too much. Over something that maybe wouldn't have bothered them, a couple of years ago, but now it's compounding. Sodium's a big one too. This is going to help me ask more questions about avoidance behavior, seeing where in their life that they are disconnected. So a lot of times in talk therapy, it's great because you're able to vocalize, how you're feeling and be really held and seen in that space. But it's another thing to tap into your body and be like, oh, wow. Like I feel that in my lower back. I feel that in my shoulders. And that allows you to know kind of where needs more support there. Potassium. This is the biggest one. This is definitely a kicker for majority of my clients. And this is big for fear. Big for fear, big for confidence, big for defeat, and big for rejection. So this really lets me know that a client needs more support around confidence and self-worth. Where are they, again, constantly pouring into others and really depleting themselves? Fear, and generally with potassium, people will explain to me that they have lower back pain. So that's always a big one I see. And that lets me know too that there's likely a trauma response or, a belief hidden that is causing some shame. And so that's another area that we explore potassium in.
So interesting. You had mentioned with the calcium one, more so with the high calcium, like the calcium shell and protection. With the other three, do you see those things come up, whether it's high or low? Like, are you looking at it differently or maybe asking different questions if they are on one end versus the other?
It depends. So with like magnesium, so because HTMA, it's kind of a challenging test to read, because like magnesium might be like off the charts and someone's like, oh, I'm taking magnesium supplements and now my magnesium is high. Actually, no, it actually means that you're burning through magnesium too fast. So it depends. With calcium, definitely the calcium shell. Low calcium though, I still see a lot of still needing that protection. And then normally the next test, it ends up going up pretty high, kind of signifying where we were getting to. So magnesium is really one of those, and calcium high or low. Potassium is really the only one. I don't see potassium. I don't think I've ever seen potassium high. I've always seen it. I don't think I have either, actually. Yeah, I've always seen it very, very low. And a big one here is people end up talking about thyroid. It's most of my people showing up with hypothyroid like symptoms, and then a lot of that. And in my world too, dealing with the lens of trauma, when I think about the thyroid and I'm thinking about the potassium, a lot of times I'll ask them about if they feel like they're not vocalizing how they feel. because of where the thyroid is located by the throat. And so before I even get HTMA results back and we're talking about, we're doing our intake call and I ask where they feel certain things in their body, most of the time my clients struggling with low potassium tell me that they feel a tightness in their throat. And that allows me to know that there is likely some communication issues, and things that aren't coming up, things that aren't being vocalized as a fear response or not having enough confidence to do so.
So interesting.
Yes, this makes me think of like when I did EMDR therapy, when I would do the like eye movements and things, and then we would pause, my therapist would always ask me like where I was feeling whatever it was. And it was always interesting where it would be like, I'm feeling tightness in my shoulders or like pressure in my forehead or, like, I feel kind of nauseous and sick to my stomach. But they would be very strong reactions. And, she always told me to just say whatever, came to mind first of what I was feeling and not, think about it too much. But it is really fascinating how like our body does communicate so much to us.
Yeah, this is definitely making me want to like look back at my own test as well as some of my other clients that I've suspected that, because I've never really had this component, and maybe I'll reach out to you and help see if you can review some to
absolutely
get a different perspective, because I think Caitlin and I talk about this a fair amount, that one of the reasons that we love testing so much is, one, it could be validating for people, especially if they've been through the ringer of like, I've done all these other tests and just been told everything's normal, but also helping people to recognize like something needs to change. And I think that leads us well into the next question, because this is something I've struggled with getting some of my clients to recognize or be willing to explore, because I know going like rehashing trauma and going through that is not a fun experience, and you have to feel ready for that. You can't really force someone to do it. But how do you get someone to recognize, and do you find that the HTMA is helpful with this, to recognize that their trauma and dealing with that really is like the next step in their journey?
Yeah. So I personally never plant the trauma seed. So when I'm going through things, the only time I'm ever mentioning trauma to a client is when I'm actually saying like, hey, out of 11 things, you had 5 trauma markers. And I leave it at that. I never want someone to feel like they have to put a label on it, because I notice that when we label things, my clients tend to shy away from it. But that is where the coaching, which is so I offer HTMA and coaching packages. That is where it comes hand in hand, because I can give people all of these like lifestyle tools and different things, but until they start really like being asked deeper questions, then they're able to explore it more. So my biggest thing is having them connect to their body. And that might look like, 5 minutes of being like, where do you feel this? And then me making the connections of being like, oh, I'm so glad we talked about that. That is actually something that signifies to me that you might be fearful about a situation. So how does fear feel in your body? You're describing it as low back pain, and then digging from there. And then fears start to come up and different things start to cascade. And rather than saying like, that's a trauma response or that's trauma, it's like, okay, well, these are some big emotions, and all emotions is energy in motion. And this energy is stuck in the body. And so until we can take this energy out of the body, we can't stuff anything good there, because it's taking up energy and space in your body. And so that's kind of how I approach things. Like I've been coaching one of my clients for almost 2 years now. And in our initial call, there were so many things that she had said to me. And I wrote everything down and I sat there and I sat on it and I was like, okay, I know that this is probably going to need to be addressed. This is going to need to be addressed. But if I had forced her, again, that's not her feeling safe of me basically being like, what caused this? We kept working together, and there was a big one, just staring at me. And every, coaching call, I would see if I could kind of chip away at this belief. And we are almost working together for 2 years, and she has made tremendous strides, but we are just now addressing that elephant in the room because she didn't feel safe enough in other areas of her life to make room in order to, move past the traumatic experience.
But
Do you
go ahead.
do you feel like people come to you and like they already know that they're going to be digging through all of this and they're like ready for that? Because I think like where Haley and I come from is we recognize this in our patients that they're having this that's causing them to be stuck. But like getting people to be willing to like dig into that or like go and see you, that transition can be so difficult.
Yes. So it is. So they do know. So before I even work with any coaching clients, I go through agreements with them. And basically it's like, we don't do expectations. These are like agreements. Can we get on the same page? Because I do have to say sometimes like, and I'll say it before I ask a question. I'm like, I'm going to ask a really, funky question. And if it doesn't feel good in your body and you don't want to answer and it gives you the ick, we can move on. But it's imperative that you vocalize that to me. So generally patients open up pretty quickly to me about these things. They're pretty quick to want to work through them. I haven't really had much pushback when I do ask the hard questions. But a big thing, before I even start, I'm like, crying is totally normal. And majority of my clients are crying during coaching calls. So I try really hard to create that safe space from the jump, like from our very first phone call, for them to feel like, which they can. It is a safe space to explore things, and know that they also have the right to be like, I'm not going here today, or like, I've had a stressful day. I want this to be, and I mean, if I had to people say that, like, I want this to be a surface level conversation. Like I need a minute. And that's fine too. So I try to give them some expectations or, some agreements of what they can think we're going to explore during our calls. But that's really where I focus my energy on.
Yeah.
I guess I would have asked then, like, if you have any tips, because obviously we work with different clientele and they're coming to us for different reasons. So Caitlin got it. Like, so many of people that come to us, like, they're looking for nutrition answers. So they're not always expecting us to bring in like the mindset piece in general, especially not like that emotional component. So I don't know, some people might feel caught off guard, or they're just, again, not in that space to recognize how that's impacting them physically. So is there any strategy? And obviously you made a great point of like not labeling it and telling them like you have trauma, but more so like leading the horse to water, I guess. But are there any recommendations that you have for us in these situations where, like, I'm thinking of this one client that I have been working with for a few years now, and she's just been up and down with her health. And honestly, unfortunately, like, things have gotten worse. Like, she got diagnosed with autoimmune diseases and things just keep progressing. And I recognize that trauma is a big piece of that, but she doesn't seem to make that connection and just keeps getting more frustrated and more sick. And it's really sad to watch. So if you have any recommendations on how to maybe guide someone to recognize that.
So I am very much I am a very much no filtered lady. So I'm pretty bold when it comes to things like that. I always ask initially, I'm like, have you ever been to therapy? That is an important question. I like to know, what was your experience? What did you do? Have you worked with a coach? These are questions I always ask up front because I just want to know kind of, what they've been, what's worked for them, what hasn't worked. So I do that in my intake call. But really just saying, I see a lot of patterns that could reflect that there's a lot of emotional things going on. Have you ever considered working with a somatic coach, or like I always say, like, I'm like, are you interested in the woo woo or not? Like, we don't have to go woo woo, but I got some woo woo for days. And that way it kind of opens up the conversation and be like, I'm happy to ask some questions if you're comfortable with it. But really just asking and being upfront, like, I'm going to be honest, I see some of these emotional things with, this gastrointestinal disorder. And I think it would be helpful if you explored therapy. If you're not open to therapy, would you be open to working with a somatic coach? Just asking those type of questions. And then if you feel comfortable digging into it, then you digging into it a little bit more for your own practice.
Yeah, I like that. And I think another challenge I see is not only how it's affecting them physically, but how they're able to show up for themselves to then help the physical side too. So it can impact them in so many different ways.
Yes. And I see this a lot with trauma. A lot of people will come to me feeling like they're like, oh, I have ADHD, I feel I can't do anything. And that is a big sign to me that things need to be explored. And majority of my clients I see have 4 lows. All 4 vitality minerals are low. And that lets me know that this is a repetitive behavior and this is a huge lifestyle overhaul. And I always set the intention with my clients that like things could get better in the next 6 months, but I can foresee us working together if the relationship is aligned for at least 6 months. And I really set the pace that like, this is slow and it's intentional action every single day. Doesn't mean you have to show up the same way every single day, but you have to make choices to push the needle forward every single day.
Yeah.
Yeah. When somebody is working with you, like what sort of things do you do to help people kind of process these emotions and handle things? And like we've talked about, talk therapy is for lots of people not enough, or they're just, kind of going through the motions with it. So yeah, what do you do differently?
Yeah, a lot of movement. Movement is huge for my practice. It is, and that's again, emotions are energy in movement. So we have to move things. So get ridiculous, jump on the trampoline, get a hula hoop, do 5 jumping jacks. Like I'm big, I will make people dance it out on calls with me. Like you're gonna get up. Where are you gonna feel this? You want to turn your camera off and shake your butt. You're gonna turn your camera off and shake your butt. But like we can't get stuck here, right? And so that's a little bit different as I try to bring a playful sense into it too, because I'm like, if you can't move the ick energy, you're going to be stuck with it. And you want to replace that ick energy with joy. So let's find it. I have some of my clients go to axe throwing, go throw an axe. We do axe throwing, pottery, doing again, hula hoop's a big one. I feel like a lot of my clients do like to do like hula hoop stuff, which is so fun. Jump roping, anything just to move that energy and not have to feel like movement has to be so redundant and so forced. And then majority of time will start with 5 minutes of somatics. I normally do, there's a Better Me app that I like. 5 minutes of somatics and work your way up. And I ask them to do this before bedtime. And this way it helps them connect before they're about to go to sleep, connect with your body. What do you feel? Where is their pain? And then their homework assignment. So when we meet again, it's like, what did you notice during your somatics? And then some people, ear pain, whatever comes up, and then we explore that. Another thing is nature. So this is like my woo part. Some people are into it, some people aren't, but connecting with nature and animals and signs. So like a yellow leaf versus an orange leaf, whatever it is, we can find silver linings or some type of connection in pretty much everything in nature. But the point of being in nature is realizing that you are such a small piece of such a big world and bringing you back into your small body, being in such a big environment. So a lot of things that incorporate them coming back to themselves, because majority of my clients that are experiencing trauma are disassociated and they don't even realize they're doing things. They're just labeling themselves as people pleasers or, type A personality and aren't moving past that, and it's not serving them.
Yeah. That's such a good point too. And I think a lot of people I work with, whether they have a history of trauma or not, I think just in general, like everyone's so disconnected from both nature and their bodies, right? We're living in this world where we're constantly on screens, we're looking elsewhere for validation and all this. So returning, and like even with the work that we do, it's like so many people are disconnected from just understanding when they're actually hungry, right? And like it's such in things that should be so innate to us, we've already disconnected. So just getting back to being able to recognize where you might be feeling the pain or what's going on in your body. I think that's really powerful too.
Yeah.
Can you go back and clarify, just for anybody who maybe doesn't understand, what you mean by like somatics?
Oh yeah.
Yes. So somatics is just moving energy. So any type of gentle movement for the body. Most of the clients who are in a, who have endured some trauma are in a burnout state. So we're doing like, this is my clients who are like, I do, HIIT workouts and I'm doing all these things and I'm not losing weight. It's because your body doesn't feel safe. So somatics, it's really kind of like yoga. There are like some yoga poses, but it's basically anything to move your body, anything to get into your body and out of your head. Trying not to make sense of things, but really just recognizing and honoring where you are right now, in order to, release and make some changes there. So somatics are honestly mostly like yoga with a little bit more movement to move that energy.
Yeah. Which can also be challenging for people, a lot of people, especially like the women that we work with, is they have this go, 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 or especially if they have a weight loss goal, they feel like they need to do more intense workouts. And that's what they feel is their stress relief too. And so that can be a challenging balance as well. Well, this has been so interesting. And again, similar to last time, we could pick your brain forever. But I probably am going to reach out to you to maybe help me review some HTMAs for my clients through a different lens, because I think that'd be really interesting. But is there anything that you'd like to leave our listeners with today? Any maybe tips to get them started if this is something that they're feeling like they want to explore more, need to explore more?
Yeah, well, I obviously, using HTMA through that lens of trauma and stress. I currently offer coaching packages with HTMA in order for clients to explore that and see how they can really make these lifestyle changes to better their future and feel their best. I own Just Wellness Nurse Coaching. So I'd love anybody has any questions, about somatics or about getting connected in your body and really tuning into what your body's trying to communicate, to reach out. And if you're going to do one thing today, get connected and move your body.
Love it.
Yeah, and in a silly way. And I feel like that's one thing that is fun about having little kids, is they kind of force you to have more fun with your movement.
Yes, this is very true.
All right. Well, thank you so much, Justine. So nice to talk to you. We will make sure to have all of your information and links in the show notes. And we will see you all next week.